Then when you are ready, give me signal to start. That you are attending to meet this. Another one, UTI, and we were able to learn with you a lot of things concerning our health in relation to urinary tract infection. And today we have come back also with another topic that is also concerning us seriously globally, that is candidiasis. That's what I wanted to talk about today. I know it is a very serious issue amongst all category of humans, whether males or females or young or old. All of us have been affected by candidiasis in one way or the other, and we've seen it as a health burden to the nation and to the world, and that's why we've taken it upon ourselves as Satellite TV, and as doctors in health we have taken that initiative that we need to give ourselves information on how we can be able to understand what candidiasis is, and then what could be the causative factors, and probably we could be able to learn on how we can be able to manage it, and then lastly we might be able to now learn on how we can be able to prevent these infections from happening with us. You are most welcome once again for this edition of Doctors Health Talk. I want to thank our moderator for giving us the privilege to have it. You're most welcome. This is Anncy Medical Center together with Satellite TV bringing out this. My dear ladies and gentlemen, the viewers of today, I don't want to waste much of our time. I want to take us straight to the topic and break it down. I will begin by giving us the definition of candidiasis. Candidiasis, in our definition of today, I can say that it is a fungal infection caused by an overgrowth of candidiasis yeast, which normally lives in small amounts in a human skin inside the gut, mouth and vagina. When this normal flora, I can call it normal flora, when it changes the form, and when the number grows bigger, you will find that it becomes a health issue, whereby you can be able to find yourself to be inconvenienced, and this could easily be a health issue with us. And mostly this is characterized by itching of the affected part. If it is affecting the vulva or the vagina, it itches. The penile, it affects the penis, it itches. So therefore I will want us to take that definition, that it is a growth of the normal flora of candida, which is a normal flora on our skin when it is in small amounts. And then when the number grows bigger, then that's when we can say it is candidiasis and it needs health attention. Common types and symptoms of candidiasis that we have around us. These types, we normally look at them at areas where it is occurring. That gives us the type. First and foremost, the most common one that we have is vaginal candidiasis. The yeast, or you can call it vaginal yeast, when now the quantity or the amount of the yeast in the vagina has grown bigger than the normal flora, then it causes what? The vaginal candidiasis. What are the signs and symptoms of this vaginal candidiasis? Normally it is characterized by intense itching or burning around the vulva, vagina, or reddening or redness of the vagina, pain during urination or intercourse, and a thick white odorless discharge. You can always be able to see it in the vulva. How does this one be able to give you the picture that surely this is candidiasis. You can be able to see the problem of itching. It is the most common ones. You find that when the itching begins to occur, a lady can easily forget that she is supposed to be doing something, and her attention is taken up fully with the itching, and then she forgets that she is in the public place and begins to scratch the vulva, and it inconveniences her. And that is one of the cardinal signs that I can be able to say that what this is candidiasis. The second cardinal sign I can give you whether this is a vulval candidiasis is when the lady discharges what? Whitish and thick discharge on the vagina. And normally this is odorless. It does not smell, but the thing is thick, whitish, not yellowish, not greenish, but it is white like paper, but it is into the what? The mouth, and then we can term that one to be what? Oral candidiasis. How do you know that this person has oral candidiasis? It is always characterized by creamy whitish patches or lesions on the tongue, inner cheeks or roof of the mouth, loss of taste, redness and pain when swallowing something. That is oral candidiasis, because this person always have that creamy whitey patches. You see those things in the mouth develops some blisters, and those blisters are looking creamy and whitish, and these are not always, they are painful, and it takes away the appetite for someone to eat food, because once the mouth is sore, is with what? Sores or with wound, obviously you feel uncomfortable to eat, and that affects your health. So therefore it is always advisable that you should be able to check and examine your mouth more oftenly. And in Anncy Medical Center, we give you the privilege to come, and we can always examine you and probably give you the treatment you deserve. That is oral candidiasis for you. Earlier on I told you we have vaginal candidiasis. Now this time we are talking about oral candidiasis. The next is what is known as cutaneous or skin candidiasis. This is characterized by red, moist, itching, rashes in warm skin fold areas such as under breasts, armpits, groin, or diaspora appears inverted. So what is something there begins to get raised, and then scratch it again. The most affected areas, like I said here, it is the folds of your body. Armpit is one of them. The skin here, once you see yourself having rashes here and they are itching, know that you have got skin candidiasis. And then it is also at the areas around the loin. We find loin means the between the thigh here, you will find you have got somewhat itching part here, and the skin here begins to peel. Once you see that, you should be aware that you have got what? The skin candidiasis. So therefore you have to take caution on that. Another thing is that that part you always experience, there's some rashes here, it is sensitive to heat. Once heat comes here, sweat comes a little, the itching becomes again and again and again. So that is skin candidiasis for you. So therefore there are many more others that we can be able to talk about, but these are the few that I can be able to give you. And then what are the causes or risk factors that is affecting or causing what? The candidiasis for you. Number one, use of antibiotics. When you overuse broad spectrum antibiotics, my viewers, it affects. How does it affect? Because these drugs here, for it to work, it cleans itself on the body cells, and then vagina or the mouth or the skin is not going to be exceptional here. The normal flora is going to be massively killed. That is the yeast. That is a normal flora in the vagina, in the mouth, and on the skin is going to be massively destroyed. Once they are now destroyed in big numbers, now you find yourself that what? The acidic level of those areas drops down, and then that gives room now for the what? For the yeast to grow in large numbers, hence causing the what? The vaginal or the oral or the skin candidiasis. And then another thing, what the antibiotics does is that it lowers your immune system, because this one is going to clean itself. These antibiotics cleans itself on the what? On the body cells, in order to eliminate the bacteria that had cleaned itself also on that same cell, to weaken it so that it kills you. The pharmacokinetics, or what is known as a chemical formula of this drug, meaning that they manufacture this drug in a way that it cleans itself on that cells and then begin to estrogen level of suffering from candidiasis. And this is a very common case, especially in pregnancy. How? I've just explained it here. Because pregnancy causes the hormonal balance to occur, allowing the estrogen level to rise and then prolactin level drops. This makes your body to suffer, and hence increasing the risk of developing candidiasis. Medical conditions which have kept you sick for a long time, such as diabetes, uncontrolled diabetes, high sugar level. When you have uncontrolled sugar level, of course now bacteria likes sugary things. When sugar is high in your blood, that will also increase the sugar level in your mouth and on your vagina, on the skin, and then this will enabling, or it will give suitable environment for the bacteria to grow in large numbers. Once the yeast grows in large numbers, you will begin to see the signs and symptoms that I had already explained earlier on, that you will begin to discharge white discharges. You will begin to see that you have painful menstruation. You will find that you have itches. Those are because of what? The sugar level which has been uncontrolled in your blood, that has caused the rise in that due to diabetes. So manage to control your diabetes level very well, especially the diabetic patients. Take your drugs of diabetes very, very well, so that you can be able to control it. Our HIV patients also suffer from the same thing here. How does that one happen? Because HIV lowers your immune system. It targets your body immune system. It destroys the CD4. That army that protects your body has been destroyed by the virus. Once this one happens, you will find that your immune system, since it is done, the bacteria will take over, the yeast will be able to grow in large numbers, because the normal flora, the immune system has dropped down due to HIV. So it can lead you to getting candidiasis, and it is a common case with people having HIV. So I'm encouraging you, those who are having HIV, take your medicine very, very well, so that you don't suffer the consequences of that missing of your drugs, plus other elements that are keeping you down for a very long time. For example, those who are suffering from hypertension related stroke, you take long to recover from that, and sometimes you lose appetite of food, and the immune system can also drop down. That can as well lead to what? Can lead to candidiasis. Another thing is moisture and hygiene. Wearing tight, wet, and non-breathable clothing creates a warm environment suitable for yeast growth. Yes, this is also another common thing which one has to take caution with. This is a very common thing, especially in the age bracket of youths, where you have few underwears, you have few clothes, you just find yourself that that's the only one you have. You just go and wash this one very fast, and then without it drying, you wear it on yourself. And this can also as well affect what your the normal flora of the what the vagina or the mouth or the skin. Hence you develop the what the fungal the candidiasis. Another thing that one has to take caution about is the medical interventions. Prolonged use of prolonged use of central catheters, ventilators, and many others, because these are supportive things that we use for someone who can be able to control urination, and then it sometimes can cause infection, especially for ladies. It can cause infection, and you begin to develop the discharges, and itches will come, and that is also another risk factor, and also the causative factors that is leading us to getting candidiasis. After learning this, probably you'll be asking yourself, where did I go wrong that I begin to have this? Another thing which I should be able to bring forward here is sharing of your clothes or your footwears or your stockings, because you find that some people, they develop also what fungus, or they develop the what itching of the toe, between their toes. And once this one is happening, it is because you have worn up a stocking which was infected with someone who is having candidiasis on the foot, and then this begins to grow, because each time the shoe covers the legs and the temperature inside there is sometimes high, and because of that you will find that what your skin in the toe, between the toes, begin to develop irritations, hence leading you to getting the candidiasis of the skin. Let us go to the preventive factors. So far so good. We have reached at the preventive tips that I wanted to give you, because I remember telling you let me typically talk about what the skin one, whereby we said earlier on, you wear wet clothes or wear within that body where that wet is touching, especially the vagina, mouth, and the armpits, and the loins. This tends to increase the risk. Now if you begin to now take precautions and dry your clothes first, iron them first, when you wear them they are going to be okay. When you wear too tight clothes on yourself, especially on the private parts, meaning that it's going to make the skins to fold on each other, especially the loins, and then you end up developing rashes between the loins which are itching, of which is typical of what candidiasis. Therefore I urge you to kindly wear clothes which are dry and not too tight, especially for men. Your balls need to be free, your loin needs to be free. Once you wear that tight one, some people wear, I don't know how many, 4 to 5. They first wear underpant, they come and wear maybe a boxer on top of it, and then again they come and they wear a pale on it, and then they wear trousers on it. How many have you worn here? Just on this same here. Do you know how many temperatures the temperature that your body needs here? It is just the normal body temperature, which is 36. Once you wear this, then the testes here will be able to be subjected to high temperatures. You may not only suffer from what candidiasis alone, but you will also suffer from other conditions related to that high temperature when you wear too tight and wet clothes. So therefore I'm urging you viewers and my clients that let us wear free and dry clothes so that we don't suffer the consequences of this. Wear breathable clothes. Opt for cotton underwears. Some of us here, we want to think about durability other than comfortability. Here I am meaning that some people, they look at that one, maybe which is made out of polyester clothes and maybe nylon, that kind of a thing, instead of wearing for the cotton one. Cotton one is always good because cotton cannot allow you to develop moistures around. Instead, it absorbs what you are about to do it, and it allows aeration to happen within your skin, and that helps you a lot. Therefore, opt to wear cotton underwears and avoid tight-fitting synthetic garments. That is my message to you. Then the third one I want to give you here is manage health conditions very, very well. For example, keep your blood glucose level under tight control if you have diabetes. Those who are having diabetes, this applies to both men and women, because if you are diabetic, I remember earlier on telling you that what diabetes increases sugar level in your blood, and then this enables conducive environment for the bacteria to grow, and yeast or the Candida albicans is one of the thing that can be able to cause this to grow as well. So therefore, I'm encouraging you to control your sugar level. Take your diabetic drugs, take them very, very timely, and then avoid those foods that you have been restricted to be eating them. Avoid them as much as possible, so that you do not raise your sugar level up, which will in turn lead you to getting the candidiasis. Another thing that you should be able to do is regular checkups. Monitor your sugar level and monitor your blood pressure. Once you already have diabetes, definitely the pressure is likely to crop in. So therefore, I'm encouraging you to monitor your health conditions so that you don't suffer a long-term bedridden conditions in your life. Otherwise, another thing that I want to bring forth is use antibiotics appropriately. Use antibiotics appropriately. We as doctors, we can prescribe for you the drug, and when we say that take the drug 2 times or 3 times or 4 times or once a day for a period of 4 to 5 days, that means we have given you a sufficient dosage. And once you take that, we have also taken into consideration the normal flora. If you again went ahead and avoid that, instead of taking your drug, which is supposed to be taken twice a day, you decide to take it 4 times a day, and you prolong the days, that will obviously lower the immune system, and hence giving growth for the yeast in your areas which is targeted for them. Therefore, you should take your drugs appropriately. Avoid self-medication. Some people here where they just there's a doctor who had prescribed for them a drug for another condition long time ago, and then for them they think each time they have a problem, after a short time, rinse your mouth. Even now, after food, please, there are some certain foods which are rich in sugar. Once you eat them, rinse your mouth. That will be able to prevent oral candidiasis. Now, for the ladies who are already suffering from this, I want to give you this health tip. Once you begin to see that you have got these itches, after the treatment is done, I encourage you to treat all your underwears very, very, very well. Even the pubic hair, you maintain them short. When you are doing this, you will cut the chain of that infection from reoccurring itself. Why do I concentrate so much on the underwears, knickers? Because in the morning, as a lady, God manufactured or made you in such a way that your reproductive system, or the vulva or the vagina, is made wet. You will find that this fluid begins to seek and clothe yourself on the underwear, and because of that, every day when you are wearing them, they keep on accumulating there, the bacteria accumulates there. And once you get your treatment done, please, I'm encouraging you, all your underwears, kindly boil them in very hot water, wash them with the Omo, and then you wash them with the tablet soap and kindly dry them in the light. And someone will ask me, in our culture of Lubara, women's underwears or downies are not supposed to be seen by the public. The advice is that when you are doing that, kindly, once you dry these things in the sun, let you cover it with your lesu or kitenge. Cover them, dry them, iron them, concentrate on the part where your buttocks sit, so that you eliminate that bacteria from your underwears. And once you are cured already, you will have at least kindly come here at Smash Roundabout drug shop, just at the Airtel Tower. You will get us here. Just come at Shalom Drug Shop. We will be able to engage your treatment here. Probably, if your case needs us to handle you at the medical center or at the hospital, we will be able to take you to our main center in order to handle you well. Otherwise, thank you very much. Let me be able to give, let me get feedback from you in my next presentation, if at all it's there. And those who are looking for us, I can as well give contacts to you in case you need us. We will be able to get it for you. Otherwise, thank you very much. Thank you so much for listening to me. May God bless you. Have a blessed evening. Are you done?